Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me, as always, is Dr. Craig Stern. And today we're going to be talking about MDMA. See, back in August, the FDA granted a nonprofit organization known as MAPS, which is the Multidisciplinary Association for Psychedelic Studies. They were granted breakthrough therapy designation for MDMA to treat patients suffering from PTSD. MDMA is known as the main ingredient in recreational drugs known as ecstasy and Molly. Without getting into all the pharmacology on it or the background of it, MDMA has shown to produce extraordinary results in the preliminary tests while studying those suffering from PTSD. So, before we go further, what I want to ask Dr. Stern here is what does it actually mean to have a breakthrough therapy designation?
Yeah, that's a good question, Alex.
Yeah.
When the staff brought this issue to me, I thought, oh, this is a pharmacology lecture and everybody's going to go to sleep. But we've decided to take this for a different perspective. And this is not about pro versus con, it's about the science. And I think that's terribly important. Breakthrough therapy means the following. It means that a therapy potentially has a great benefit where there have not been other therapies that were as impressive before.
Okay.
So in that regard, a breakthrough therapy is going to be studied. It's going to go through similar activities and that we'll talk about in a moment with regard to science. But it's on a fast track. So it's something that isn't going to be held up because of paperwork or time that it takes in order for information to flow, but rather it's put on a fast track so that if there are benefits, they're going to be identified and then potentially get to the market faster than they would if they were under a traditional program. That's number one. But let's talk for a moment about science. And I think this is terribly important. When one looks at overall our environment today, whether it's political, whether it's social, whether it's commercial, there's this tremendous issue of arguing of what is science and what is fiction, and people saying that no, they agree or they don't agree with particular scientific principles. But the science is very clear, so let's talk about it. What you're talking about when you take a drug and you put it through scientific methodology is this. Number one, is you're asking a question. The first question you're asking is the drug effective? Does it work?
Right.
And second is it safe? Because if it isn't safe, then it may be very effective, but then people are going to get sick, they may die, there may be other problems, and so you can't may lead to other issues, and you certainly don't want that. Okay, so the main issue here is the first issue is what's the question? Is it effective? And then number two is a method to study it that doesn't create bias in the system so that you're trying to bias it for a positive result that it does work, or potentially a negative result that it doesn't work. And so you're examining the world and saying, what kind of populations do I have to include that tries to minimize the bias as much as possible? You never eliminate it, but you try and do that. And then number three in that regard is you need a test group. You need a placebo group or a group that you can compare against. Because it's one thing to say, well, something may work, but you don't know whether it works any better or any worse than everything else. In the world that we're living in today, there is PTSD therapy. It includes drugs, it includes psychotherapy, and about 70% of the people are influenced and have a positive benefit from that. So in this regard, in a breakthrough therapy, the issue is are you going to improve the care of at least 30% of the population that that doesn't benefit from what is currently going on? Okay. And hold on one second.
Go ahead.
And then finally is the issue of a breakthrough therapy could be a benefit now, but you don't know what the consequence is going to be over time. And so you look at these things and you try and do it over a time period, which is why in cancer chemotherapy, there's the 5-year time period to see if the condition arises again, or if cells and clones are still there and creating a problem. It occurs in all kinds of therapies with MS and Parkinson's disease and a host of other issues. Bottom line is something that is important can't be just a flash in the pan. It has to show some duration and has to be able to benefit over a long period of time, and clearly benefiting over whatever the placebo is, or more importantly than that, what the current therapy is.
Right, right. And it's important to note that this breakthrough therapy designation doesn't mean that it's already approved and you can start getting prescribed this drug. It just moves the testing from phase 2 to phase 3, which is the long-term effects, the safety, and seeing if these positive results that they're seeing in phase 2 continue over a long period of time, as Dr. Stern said. And another thing that I found interesting was, according to the Journal of the American Medical Association, they revealed that GoTo Treatments for PTSD has not had the results that they had hoped for. Now, you mentioned that it did show signs of improvement for 70%, but it wasn't exactly what they were hoping for. And just wanted to go into some detail about what those GoTo treatments actually are.
Yeah, in behavioral health, there are no cures.
Uh-huh.
There are treatments. So yes, we can talk about something that has a significant benefit, but it doesn't mean that everybody is going to be instantaneously cured with 3 doses of the drug and that somehow there's going to be a tremendous improvement. It's not like certain antibiotics used in infections or hepatitis C drugs right now that are being used to treat that cut the number of clones or cells down to indeterminate levels and then it's cured. In this particular case, there are no cures. Well, there's also, what is also important in behavioral health is that there is a combination of therapy that works in tandem. Drugs are involved. Drugs like Prozac, for example, are used for PTSD. And the role of the drugs is effectively, without being too colloquial about it, is to calm the patient down, is to take away some of their really obvious symptomatology so that psychotherapy can take over. So there's a cooperation between drugs and psychotherapy. Psychotherapy doesn't solve the problem. Drugs don't solve the problem. But working in coordination, you have a better impact. Now, what is true is that you give a person drugs, you have certain behavioral modification type therapies that go on, and those behavioral therapies deal with either bringing up the very disturbing problems that created the PTSD, or trying to move ahead with how do you live life today and deal with those kind of issues. But either way, what you're dealing with are not cures, but rather trying to put the patient at some sort of a common denominator so that psychotherapy can take over. Nothing is a cure. Even if you have a positive response and someone can go back to functioning regularly and have normal activities of daily living, they still may very well have symptomatology of PTSD that either they're going to have to live with or address. And so it's no surprise that there is a positive benefit in about 70% of the patient population, but after it's done, they can function, they can lead regular lives, but they still have sequelae to the issue. And it doesn't mean that they're going to go out and hurt themselves or hurt someone else. It just means that emotionally they do continue to have that. It's not a cure, doesn't immediately wipe all of that out either. And the new therapy with MDMA, et cetera, doesn't necessarily mean it's going to be a positive cure and nobody has to deal with anything else. The MDMA therapy requires at least 3 doses over 8 hours apiece, sitting with a psychotherapist, working through the problems. So it's not a drug this and immediately someone gets a response. It's a cooperation between the two. And no one knows whether in the long term that there'll still be some sort of symptomatology. It may just break through for those people that typical therapy couldn't solve.
Right.
And as a result of that, this finally gives them some relief, which is important. Nobody is minimizing that in any way,
Mhm.
but it still has to go through the scientific process to make sure that we're dealing with something that is safe, is effective, and is going to have some long-term benefit.
And it's worth noting that um, you mentioned that there is no cure for it, and that was actually my next question. Like, can it be a cure? Well, apparently not. Well, but I also had another question as in regards to MDMA and the other treatments that are available for PTSD, and that having that we know that the VA looks at two treatments altogether. It's a cognitive processing therapy and also PE, which is the can you help me with that one? PE was
You're talking about the physical, emotional
yeah, the
component.
physical emotional component. Okay, with those two, but having a third option, would that be um, too much for a behavioral therapist to help with this PTSD? I mean, having more options available shouldn't be debated against. I'm not.
No,
Am
no,
I
no, 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 no. Nobody should be arguing
right?
that if there's some improvement, and all therapy, by the way,
Right.
has improved over time. Whether you're treating high blood pressure, what we did 20 years ago is not the same what we're treating today. Diabetes is not the same as what we're doing today, or even what we did 10 years ago.
Right.
Um,
It's
no,
just
absolutely.
the controversy behind it being that it's MDMA. I
Mhm.
mean, most politicians might look at that and just think immediately ecstasy or Molly, and then other behavioral doctors might, psychiatrists might think that using a recreational drug might promote abuse, and those type of things that come into play. How can you avoid looking at ecstasy and Molly and just think of MDMA as the pure treatment for
Well,
PTSD?
look, we talked about this on a prior thing where
Mm,
we talked about marijuana, and it
right,
was a similar kind of issue, and that is you're dealing with drugs that are Title One, meaning that they cannot be sold in the United States, they
right,
can't be studied in the United States. You
right,
can't do a physical study on them because they're Title One, and so therefore it limits what the use is. But there is a stigma attached to all of this, right?
of
I
course.
mean, you've got ecstasy and all of the cultural and social issues that go with it, marijuana, issues with what goes on. Our problem here is we're talking about not social use, but a very clear therapeutic use, which means that one, you identify the patient population specifically that could benefit or not. That doesn't mean everybody.
Right,
It means a specific population. In this case, people who have PTSD who have not responded to other therapies.
right,
Two is you don't release it, or at least the goal would be you don't release it to everybody so that everybody can experiment with this.
right,
Because what MDMA requires, at least so far, is that you have very experienced psychotherapists that are leading this therapy.
uh-huh,
It can't be just any psychiatrist, can't be just any physician or any group at all. This requires very specific training and experience with what goes on so that they know what to do and how to handle it if it's not going well.
right,
And third is that the stigma that's attached may be very well placed if you put this across an entire population. But when you've limited it to a specific population, then the question is, are you getting a greater benefit than whatever the current therapy is,
uh-huh,
whatever the rest of the population is doing, because there's a natural progression to all disease, including PTSD. Certainly, the VA has a tremendous role in it with regard to PTSD, but there's also PTSD that occurs in people that have undergone major trauma.
right,
Um, People, for example, in Las Vegas with what went on are going to have trauma, and there will be PTSD out of this as
yeah,
well. And
definitely,
they're not soldiers or people that were involved in wartime situation, but it's similar.
right,
And so what you're trying to do is move from this social stigma, the commercial stigma, to a very specific population of people that can get it. The fear
Mm-hmm.
is that if it becomes available and is demonstrated to be of benefit, then there'll be some leakage, that people will get it, like
Right.
say certain psychiatrists will get it, but it'll leak out of that, it'll be used by other people for common means,
Or
and
maybe want to
clearly
use the legal version and
in all
it gets
kinds
the
of
same.
things.
Yeah.
And it could, I mean, the argument has been given for marijuana, the argument now is given for MDMA, and those kind of things are terribly important for the world to understand. Where's the science? What is this? And this is not an excuse that says that, well, okay, now you're going to give us a green light. We can use MDMA and then we can use marijuana and all the rest of this stuff and everybody will be happy. It's not what's happening.
Right.
This is purely trying to use it as a treatment, and whether the treatment works or not will depend on what the scientific studies show.
Yes, of course. And a very interesting topic. And if you have any other questions, please feel free to leave a comment below. That's all for this edition of Professor Speaks. Please feel free to visit our webpage. It's propharmaconsultants.com. We have a free information page called RxInfoX. And once again, if you have any questions, please leave them below. And we will see you next week.